So I want to go back to something you said earlier real quick. I don't remember the name of the guest, but the guest that was talking about how a lot of her patients have trouble sticking with a ketogenic diet. And so she has them just do like a low carb diet instead, sort of.
Yeah, Vivian Lowe, L-O-H.
Okay, Vivian Lowe. So speaking of which, there's a lot of discussion, a lot of hand wringing about, is a ketogenic diet sustainable and will people be able to stick to it? So kind of what are your top few kind of thoughts and maybe tips, if you have any,
Yeah.
in terms of like compliance and feasibility and kind of being able to actually stick with the diet?
Yeah, I think that's mostly all nonsense, but that's spoken as somebody who did it most of their life. So I'm a wrong person to ask, right?
Oh, okay.
But, I travel a lot. I have to eat out with groups, and it's perfectly doable in a restaurant or anywhere. I don't make a big scene about it. I don't give the keto speech, it's pretty easy to do these days. In fact, sometimes waitresses will go, "Oh, low carb" or something, but I don't say anything about it. I just order what I like to eat. I don't see a problem sustaining it. I think that's another just sort of malarkey piece.
Yeah. Yeah. I mean, there's a lot of different, beginners struggle for multiple reasons. And one of them is like if they don't feel great at first. And as you talked about on the interview with Jeff Volek, like getting extra sodium is really important because now you're like, excreting more sodium. So that's like a big one that's going to help with a lot of the so-called keto flu symptoms. And then there's the environmental pressures. You talked about the restaurants. Some restaurants, it's hard to find like a good low carb option. And then you've got all these holiday feasts and family events and sweets and treats. And so if
that's a bigger problem.
The
social pressure is a bigger problem, and people feeling uncomfortable, obviously eating strangely compared to their friends, right? So I spend a lot of time in Italy, and the Italians are absolutely shocked. They're like, "What is he doing? He didn't eat his pasta," or tonight I'm going to an Italian restaurant, and everyone in the group will order these pizzas, and they'll give me pieces. But guess what? You scrape them. I won't eat the crust. I'll eat all the goodies that are on it.
Oh, okay. Just taking everything off except the bread.
Just scrape it off. But it's not a big deal. And I don't care. Somebody will say, "Oh, look, he eats funny." I say, "Yeah, but I can see my shoes."
Yeah. So just a really brief tangent, the whole compliance thing, as Vivian Lowe was talking about, I think I heard Dr. Jason Fung actually explain one time years ago. I don't know if he would remember this, but it was on some podcast or something, but that maybe one of the reasons he started using fasting so much with his patients was because he had kind of tried to have them do low carb and that sometimes they struggled with adopting it for all the usual reasons. That was kind of before it became as trendy as it is nowadays. It's been more normalized. It's a little bit, it's not as weird to say, "Oh, I'm doing keto" or "I'm doing low carb" as maybe it was 5 or 10 years ago. But
and fasting is the easiest. Fasting's easier because you don't have to coach them except to say, "Eat nothing." And I find it remarkable that people would prefer to eat nothing than something. But if they would prefer to eat nothing than something, then the way to go, I think, is intermittent fasting. Not long-term fasting where you'll experience muscle wasting, but intermittent fasting, and then fit enough protein into your eating window to maintain muscle mass. Because as young as you are, this is the time in your middle age and in youth, muscle is like your retirement account. It's like your 401k or your 403b, where when you're young and middle age, you put deposits in, I hope, right? And at some point, you'll be withdrawing. You're going to be withdrawing from your retirement account. And when you're in your 80s, I don't care what you do, you're going to be withdrawing from your muscle mass account. And it's not a vanity thing. This is how we lose our independence. Typically, if it's not dementia, it's loss of muscle. So Granny can't get out of her chair. Well, that's a problem. Or Dad falls down, can't get up. That's a problem. They're going to lose their independence over that issue. And frailty is one of the main things that's a problem as you get older. And you can kick that down the road if you go into that period of your life with more muscle mass and muscle quality.